Hi, I'm Dr. Marilyn Kindig from Boonshoff School of Medicine at Wright State University, Dayton, Ohio. Today, our objectives are: the participant teachers will verbalize how the best student education is active learning. The physician teachers will value their own students teaching other students as a deep understanding of subjects occur. The participants will begin to construct a model using Articulate Rise. Today, we plan to showcase a completed Articulate module, look at some student comments on why this education was helpful, and introduce a new module with quizzing options included. As we get started then today, please feel free to email me at marilyn.kindig@wright.edu. The following pre-questions. Have you heard of Articulate 360? Do you think learning via the computer can be as helpful as clinical cases? Do you think students teaching students would be helpful in your classes? Do you currently have students assisting with teaching in your classes? Are you surprised to find that students value other students' opinions and information? As a part of their job, our resident physicians need to know how to educate others now and later in life, teaching allied health colleagues and their patients. Our physicians realize later in their training that they will have to teach others as a part of their life's work. Preparing our physician leaders then to recognize that they're going to have to educate each other. To teach is this first hurdle that they have to overcome in residency. These physicians will need to teach allied health personnel after they start practicing medicine and their patients. Residents are also challenged with teaching medical students and learners that will come to their residency program.
Hello, my name is Ariel Lanier, and I'm a fourth-year medical student at Wright State University. I used Articulate to create a module on normal obstetrics for third-year medical students. After the module was released, I received many positive comments from the students. In addition, I really enjoyed making the module because it was a fun way for me to review the material and also learn it in a deeper manner.
Hi, my name is Julie Slivey. I'm a fourth-year medical student applying OBGYN this year. I did the Articulate module for urogynecology and menopause. This experience was really good for me. It was awesome to look at what we actually need to learn as third years and then translate that into a module that is interactive and keeps your interest. Sometimes going through PowerPoints just as a student can be mind-numbing, and having these interactive modules where you get the key information and just as someone who is making it, finding a way to engage the student and keeping them engaged and also learning the material. I think I learned a lot about what's relevant and what's not, and what my actual learning objective is and what information to include, which I think is really going to help me as a future educator during residency. I know in residencies, a question they often ask is, how would you teach certain material? And I think putting the module together and then this module being used in the third year curriculum is something that's going to be really great for me to talk about, and just a really good foundation for me as I become even more of an educator in residency. I showed a lot of my friends in my class the module, and they were like, wow, I wish we would have had this during our clerkship. I had some of the current third years reach out to me and just say that they really liked the module instead of PowerPoints, and the interactive nature and just the questions, making sure they really reinforce the information as well. It was overall just a really good learning experience and something that I'm excited to talk about during my residency interviews.
Let's pretend then we are looking at a slide presentation for an in-person or virtual class. A 32-year-old para 2 gynecology patient who speaks only Spanish is being seen for a well women exam. Her blood pressure is 148/90 today. She was seen a few months ago by her PCP and was started on lisinopril 10 milligrams for hypertension, but did not fill her prescription. She has been taking oral contraceptive pills consistently for birth control since her last pregnancy. Her sister is present at the visit and has assisted the patient with filling out the paperwork. Now let's look at that same information as an Articulate module. Our fourth-year students then can write Articulate 360 computer modules using any topic needed by teaching physicians that needs to be taught in a clinical rotation. The easiest way is to take a slide presentation and make it into an Articulate module by using cases, asking questions, and really talking to the student instead of telling learners facts. Our students' brain engages when they're asked questions, and they have to give each point consideration. Educational research can also be done on these projects, encouraging our learners on the part of a student teacher. When these ideas are used for students, the topic then comes up on residency interviews for how did you educate or what kind of a teaching background might you have. This will improve the student's candidacy for their desired residency position. Our students look well prepared then when they have taught, done educational research, written objectives, and quiz questions. These are adult learners, and this type of education works well for our medical students. The thought of students teaching students has been missing in our medical school education. Although resident education of students happens clinically, this instruction does not happen formally in the classroom. Academic medicine options for practice are then often not presented to residents, and our residents too often want to complete their residency and get out to practice medicine without even thinking about an academic medicine track. The ability to work within their medical school as teachers will allow our medical students more marketability within the AAMC, or Association of Medical College, for their residency application, and it is requested among residency applicants.
My name is Alana Grisham, a fourth-year medical student at Boonshoff School of Medicine. Under the guidance of Dr. Kindig, I created an educational module for third-year medical students in the OBGYN clerkship using Articulate 360. The experience was amazing, and as a result, I plan on pursuing a career in academic medicine.
The project chosen today, then, is to educate physicians in obstetrics and gynecology to use Articulate modules written by students for students, and to teach others so we can guide the physician educator with the student together. Students and physicians are now asking at Boonshoff about modules, how to complete them, and why these are best for learning.
Now, as we look at RISE 360, we're able to see our choices to start our Articulate module. Of course, we need the title. So we'll write stress in medical school. We're able to describe our course, of course. My name is here, but a student could be there as well. As we type our introduction and hit enter, we can add content, add information, and objectives, and add a case, and another case. And then we have our information all set up to get started. For our introduction, we may want a blank lesson or add a template, or maybe start with a quiz. Of course, there's lots of other interaction with sorting activities, putting things in an order, looking at knowledge check to see if they can answer a question, multiple response, fill in the blank, matching, or drawing from the question bank. Adding information in one of your areas, then you can add media, either a picture you've taken, something you found on YouTube, or record audio. Then these options are available in Articulate to look through, as well as changing colors, types, adding pictures. There is a 1 month free membership, and then you can transfer that module into your long-term module, so I can make changes if I would like to.
Our physicians and medical students are looking for ways to interact and work together. Student evaluations then of the physician teacher are so improved when they work together as a team.
Hi, my name is Natalie Castillo, and I'm a third-year medical student at Boonshoff. I just finished my OBGYN rotation. I really liked them and found them very helpful because on the modules themselves, they provided 2 or 3 cases that had to do with different OB topics, and it gave us the opportunity to apply the knowledge that we were learning throughout our rotation.
Thanks so much for joining me today. Are you impressed with what Articulate 360 has to offer? Do you think learning via the computer can be as helpful as clinical cases in person? Do you think students teaching students would be helpful in your clerkship? And will you have students teach students in the future in your classes? Please email me at marilyn.kindig@wright.edu.